Thanks everybody for joining today's UX talk. So today we have a very special guest, Dr. Gyles Morrison. He's now in Germany. So he's MBBS and just please just mute. Uh, okay. Yeah. So thanks everybody for in this time you have joined for this our interesting UX talk. So before we start our session, I will just use 2 minutes to I will introduce a new member. What is UX talk is all about. So UX talk we created as a platform. Uh, Purpose is to give awareness to the community, design community. There are a lot of people have enter in this field. uh, so idea behind UX Talk, we started season 1 last year and we now in season 2. So we have very good speaker from Indian speakers and international speakers also. They bring their expertise and they bring a lot of good topics in the discussion. So in now in season 2 and we have very interesting speaker today, Mr. Giles. Hello. Uh,
Hi everyone.
so today our topic is very again topic is also very interesting. So we are talking about uh, one second. Oh, sorry. So we are talking about clinical UX and the COVID situations what we have. Uh, there is a UX and now there is a clinical UX something. So we'll try to uh, find out the differentiation between these two terms and what are uh, and obviously our speaker will give us a lot of insight about how he's basically my very first question to him is from MBBS how you taken this as a UX. Okay, so let's start today's UX talk and I request Mr. Dr. Giles to introduce himself to our audience and probably my next question will be so I'm attaching two questions here so that you can continuously you can talk. So first question is obviously you introduce yourself to our audience and what makes you from being a MBBS you shift to this UX field. So you can start
Sure.
with this.
Yeah. So I actually started out working as a medical doctor, as you know. I worked as a doctor for 3 years. I trained at Barts London School of Medicine. It's the same hospital actually that I was born in. So I'm definitely from East End of London. When I was working as a doctor, as much as I loved working with patients, I realized that I wanted to do something just a bit more creative and also to have more ability to solve more of the problems that patients and also fellow clinical professionals were having, which you just don't really have the time for when you're working as a doctor, especially as a junior doctor. It's just loads of administrative tasks that you're having to do, discharge letters, prescription charts, it's just lots and lots of admin. And so I realized that I wouldn't be able to really make the difference that I wanted to make as a professional by working as a doctor. So that's why I decided to take the leap into digital health. I didn't have any specific strong UX skills. The main thing is that I knew that I loved working with computers. I loved working in medicine. I loved helping people. I liked human biology and sciences in general. And also it was about understanding that, you know, there's my ability to develop skills in IT quite quickly and also creative skills, art, music, stuff like that. I'm very good at that sort of stuff. So I wanted to see how could I bring all of those skills and those interests and combine it into a profession. So flash forward to now 2021, I work as a clinical UX specialist. So I specialize in clinical UX. And I think the best way to describe and define clinical UX is to first look at, well, what actually is UX? So UX to me is about the interactions that people have with anything that's been designed. But I focus on the interactions that clinicians and patients have with healthcare technology and services, especially when the same technology or service has to be utilized by clinicians and patients. And we can talk about that and give some examples a bit later. So that's the bulk of what I do. And so the reason why I moved, as I explained, is that I wanted to be able to be more creative, to be able to solve more problems, and to have a very different work-life balance. I do work on weekends at times, but I don't have to. I can work at night, but again, I don't have to, especially I'm a married man, I don't want my wife to be upset that I'm working all throughout the day and all throughout the night. So I have a better work-life balance as a result. But it's crucially about me being able to work on so many different projects, like I said, that can impact patients to improve their health, get the general public to have better health outcomes, and also for clinicians, be it doctors, nurses, other healthcare professionals, to be able to do their job more efficiently, sometimes more in a safe environment, less stress, less burnout, things like that. And I never knew of UX before when I was working as a doctor. I never heard of the term UX before. And I never really knew that there would be the ability for me to bring so much of my medical expertise and knowledge into an IT role, even though I'm not seeing patients as a traditional doctor, but there's huge amounts of transferable skills and knowledge from working as a doctor or other healthcare professional to UX. And so that's what's made it a lot easier for me to adapt. With that said, I've still got a master's in human computer interaction. I have a variety of mentors that I learn from. Obviously, I'm very popular on LinkedIn. A lot of us try to be on LinkedIn through messaging people, commenting, leaving my own posts. I share what I've learned, but I also learn from others. I think that's really, really important. And then I've worked on a large variety of healthcare projects as well.
Right.
Hopefully that answers your questions.
Yeah, definitely. And I think this is very interesting for, because for other people also who are trying to switch somewhere, and I think this is very inspirational for. So yes, my next question is, there is obviously, we do a traditional UX. We follow human computer interaction, user-centered design. Some people may follow another design processes like design thinking or some other things. But there is one, please, just mute. Okay. Thanks, please, if possible, mute participants. Yeah. So definitely, so we heard about term user experience and sorry. Okay. So, but there is a term we are now using, that is a clinical UX. Also, we already, many companies and many people are here also, maybe some participants are already working in a healthcare. So there is, people know what is healthcare industry is all about. So we know some softwares need to be built for healthcare systems. So when you say clinical UX, so what is the difference, and what is your views on this thing? And
yeah, this is a good question. So the first way of trying to see the difference between healthcare UX and clinical UX is seeing, well, who could be the potential user? Now, generally speaking, in healthcare UX, you could work on something that anybody could be the user. So it's not a specific type of clinician or a specific type of patient. It could be anybody in the world, anybody in the general public. And as well, the actual product that they're using may be related to healthcare, but actually isn't providing any direct healthcare services to a patient, or is used as a tool to provide those healthcare tools and healthcare services. So for example, you could be in healthcare UX and primarily what you're working on is a platform for healthcare insurance. That's definitely healthcare UX. It's an insurance product, but there's healthcare elements because you need to have an understanding of what's going on with the patients, why they would make a claim, what situation they're in when they're making a claim, things like that. So there's some understanding of healthcare that's needed, but it doesn't provide direct care. Whereas if you look at something like an electronic health record system, EHR solution, now that would be very much within the realm of clinical UX, because that tool is used in providing care to patients. Like the doctor, nurses, other healthcare professionals go to an EHR to get information about a patient, and then they use that information to decide what they're going to do next with the patient. And likewise, the patient could be looking at that record to decide, well, when's my next appointment? You know, what medications has my doctor told me to have? So they may not see the whole of the record, but it's a part of that which can then impact their own health outcomes. So I think that's the first big distinction is who would be using it. Generally speaking, in clinical UX, there's going to be clinicians and or patients using the product, and also the implications of things going wrong tend to be more severe as you go into the realm of clinical UX, whereas healthcare UX. Whereas in healthcare UX, if that healthcare insurance product was to fail, then someone might have a delay in getting paid, or this wasn't a claim that was filed very easily. But if the EHR solution is not working properly, a clinician could be using the wrong data, and that could cause harm or death to the patient. So as a result of the risk of harm being higher oftentimes in clinical UX, there's a lot more consideration relating to laws and regulations, which has to be taken into consideration, and ethics, things like that. And again, the whole process is involved because the outcome of failure could be death, is that the way the clinicians are working and the steps you have in place to prevent patients from harming themselves means there's loads of complexity that needs to be understood, which sometimes doesn't necessarily mean you have to have a medical degree, but having deep understanding of diseases, deep understanding of how clinicians are working, deep understanding of how patients are responding to the healthcare service they're being given has to be considered whilst you're designing and improving a product. So I see clinical UX as being just a more specialized niched area in healthcare UX, where the stakes are a little bit higher. Risk of harm can be a bit higher and things are just a bit more complicated, but the core skill of a UX professional would be the same.
I think that was a great answer, and I think there is obviously a difference, and I think you correctly mentioned those things. But I have very interesting question to ask before we move on our pandemic and COVID things. See, as you are a trained doctor, right? You are a trained professional in a medicine, but see, in IT sector, people have a different kind of a mindset. The processes, maybe agile development or some kind of, the technical jargons. We guys basically, when we work we call ourselves as a corporate. And so how difficult for you, okay? Because see, whenever we practice UX, and when we do a stakeholder interviews, so obviously we interview doctors, we interview patients, so that aspect is a different. But as a being yourself as a doctor, and now you have to deal with maybe people like who are like a programmer, or who are like typical IT people. How it is difficult for you, or your medical field experience help you some way, or how is that your initial days when you started this venture, when you start this career adoption?
Mm-hmm. I think definitely coming from a clinical background into UX and into IT in general, you have, if you're at least in the digital health space, you're always going to face challenges, but if it's in the digital health space, you're also going to have some advantages. So let's first explore those disadvantages, those challenges that you face. Like you said, you're having to deal with IT professionals who have very high technical skill and knowledge, then actually there's a whole language that they're used to. When they say, when they start talking about certain technologies relating to web apps or native apps, there's loads of other things that they're saying. Like if you say you're working on a native app, you're instantly telling me what sort of code that you're going to be using. You're already telling me some of the considerations on access to data or functionality from a phone versus functionality just through running stuff through a web browser. So it's things like that where the terminology has more meaning behind it. And that's something you just have to learn. And it's very similar to in medicine. There's times, I can take for granted if I say to someone, loads of abbreviations, PE, HOCM, some people know PE means pulmonary embolism. HOCM, people are like, what are you talking about? What kind of made up words are you saying? But it's a real thing, Holcomb, hypertrophic obstructive pulmonary myopathy. So there's real terms that I had to learn in medicine, which took time to get. And it's processes, the way that people do things, especially things like understanding the realities of agile. Like loads of people say they do agile and it's not really that agile. It still ends up being a bit waterfall, to be honest. It's like, well, we've committed to doing this and we've got a tight deadline, so we don't have time to make those changes. So it just ends up being waterfall, but that's a whole other discussion. But it's things like that where it's not just learning stuff from a textbook. You have to have experiences. That's taken time. You know, I think the knowledge to work effectively with developers, especially, and with big corporate teams, that's taken years to develop, really, especially if you've not been trained to know that stuff initially. With that said, the advantage is quite profound, I think, especially in the UX side of things. Not so much if I was to go and be a developer, that's all just new. There's not a lot transferable from medicine to development, but there's huge transferability from medicine to UX. So by far the greatest transferable skill is that, or rather mindset even, that mindset that you have to go through a process of exploring a problem to then narrow down and define it, to then explore potential solutions and then narrow down on the best solution. So for me, that's just trying to diagnose and treat a patient. Someone tells me that they've got chest pain. It could be all causes of chest pain. It could be heart attack, could be a clot on the lung. It could be indigestion for something dodgy that they've eaten, you know? It could be rib pain because they've been in a fight. I have to ask more questions, do investigations, blood tests, examination, chest x-ray, stuff like that. When I've got an idea of what's going on, I can diagnose and say, well, actually, I think you've had a heart attack. And the heart attack has been a mild one, or the heart attack's been so severe you need to go and have surgery, you need to be on this medication. And even though I've given that treatment and I'm hoping it's going to work, I still need to observe and see what's happened and then do another evaluation, maybe days or weeks down the line to see that they're still okay. So that process of diagnosing and treating is very much the double diamond design process. Explore the problem and explore the solution, problem space, solution space type thing. So that was really, really powerful in me being able to understand what I need to do to create great solutions in healthcare. Then the other thing as well that we have to keep in mind is that doctors, a huge amount of their job is actually stakeholder management. You have to engage with your patient to keep them as informed and as positive and as healthy as possible. We fall short of this at times. We can still let our patients down in that regard, but still you're trying to keep that patient optimistic, keep them informed, because they need to be included in the decision-making process that you're doing for them. So that way of dealing with patients and also being able to ask questions in such a way that you're not leading the patient or leading anybody you're speaking to, but especially the patient, you're getting the truth from them as much as possible. That's a core skill. It's a psychology discipline, isn't it? It's a science of interviews and observational study. That's part of your first weeks at medical school, to be honest. So that was very, very transferable. And I think the final area that's really important, especially in healthcare UX, is the concept of patient-centered care and what that looks like in healthcare UX and clinical UX, which would be more of sort of like patient-centered or people-centered design. So in patient-centered care, as I'm sure you can imagine, it's about keeping the needs, the wants, the limitations of the patient at the center of all the decision-making made for their care. So if a patient is unconscious and it's an unconscious mother who's got an unborn child, you would hope that, especially if she's far gone into the pregnancy, she wants you to do everything as possible to keep her unborn child alive. So you don't have to speak to her to know that. And you should have the humanity, the empathy to know that. And that's what really patient-centered care is about. And that transfers the same into clinical UX. How am I designing tools that are really going to help people make a difference in their lives, whether it's as simple as them prescribing medication for a patient or to help them in giving the bad news that their patient's going to die, or for a patient to actually how can they actually change their behavior if they really don't want to diet, they really don't want to take this new medication, they don't want to have this surgery? How can you get them to actually adopt this new way of living with new medications, new treatments? And that comes again from that concept of patient-centered care. So definitely the diagnosing process that I'm used to as a doctor, the general stakeholder management and being able to interview people and speak to them to get truth from them. And then patient-centered care, those as transferable skills and mindsets has been invaluable in me, not just working well in this field, but also developing my skills quickly.
I think I think this is very I see very common uh, lines there when we practice UX, and how you mold, I think, yourself into this clinic IT profession. Okay, now before we start on some COVID related questions, I have in one question in mind. As a overall, you must have speaking with lot of even doctors and patients also. So how you see this pandemic overall is have impact on entirely our healthcare system itself, and where the user, and when we ask, because here in India, uh, we for even the vaccination we have to use one mobile application. So
Mhm.
there is a technology intervention is there. So there is a problem I see. All users are not technically experts. All users are not technical savvy. So how you take in, so how this impact, pandemic impact is happening on healthcare system?
It is a good question. So there's loads to this. So I'll probably stick more towards how it has impacts that I've noticed and how it's even impacted me as
What is it? Sorry, just request, please mute on your microphone. Please, yeah, you can continue.
Mhm. Right. So when I look at COVID and healthcare in general, the big things I try to draw upon is the people that I'm most worried about. So I think there's two thoughts that I have that drives further thinking. One is a scene from Men in Black. I don't know if you're all familiar with the film Men in Black. Will Smith, Tommy Lee Jones, and Will Smith is being faced with the fact that aliens actually exist, and he's like, "Why don't you just tell people?" And so Tommy Lee Jones's character explains to him that well, people, a person, an individual person, they're smart. You could obviously explain things to an individual about what's going on with uh, COVID, or with in the film's case, aliens. But people, they're crazy. They're animals. They wouldn't know how to handle this information. So you can't just tell it to everybody. Now I hope there isn't any lies being spread about COVID, but the principle there of the fact that you can't control a whole population easily still stands true with COVID-19. You can't expect everybody to be rational and just respond in the most appropriate way. And because of the fact that there's going to be people reacting in so many different ways, it's almost infinite possibilities. And so, again, just like in UX, or people like to liken it to Disney, they try to be entertainment for everybody, but you can't please 100% of people. There's going to be some people that are not happy. So you got to think about, out of all of the people who you would hope would be a user of your product or service, who are the ones that are going to struggle the most? So it's beyond this whole idea, well, maybe a patient who's blind is going to struggle the most. It needs to be beyond that, because you should already be making products and services accessible to the blind within reason. A blind person should go to cinema, be able to watch a film, just like a blind person should be able to go to hospital, see a doctor. So to me, it's like, what goes beyond that? And I find that the more extreme so-called limiting users of a healthcare service, or otherwise these vulnerable people, they're going to be people like, the elderly, who are isolated. someone who is got very, very low income that they struggle to even feed themselves. We're talking about people who they're in a country, but because perhaps they're asylum seekers or migrant, they don't have automatic rights to services. So when I start thinking about these limiting users, and I think, well, what are the situations that they could face? Suddenly you get these extreme reactions as well that have to be considered. So for example, we know that there's people who are generally socially distancing and keeping themselves at home, but they go into the extreme where even if they're in an emergency situation, they may still not seek out medical advice, medical attention, because they don't want to spread COVID. So they could even be having a heart attack at home and they're like, you know what, it's better and safer for me to stay at home for everybody else so they don't get COVID from me, even if they haven't been diagnosed with COVID. So it's not even just, oh, I don't want to get COVID. I don't want to give it to anybody else. But that's not appropriate. In fact, you're expected, if you are suffering, if you need healthcare services, you're supposed to seek them out in COVID. You're not supposed to not see a doctor when you're sick. Just to be clear, if anybody had any doubt about that. But then the other extreme is there's people like, COVID's not real, it's just a conspiracy, they're just trying to control me, someone is going to get so much money out of COVID. And then I'm hearing of stories, I've seen even videos, people, they will lick the poles on the trains, they will lick or sneeze on the handles of doors, you know, car doors outside people's houses. And I'm like, you're deliberately trying to infect people, or you're pretending that it doesn't exist, and you're deliberately acting in ways that could be infecting people. This is wrong. Now, all of those people, whether it's the poor person, someone who's homeless, someone who's an asylum seeker, someone who, you know, is afraid to come out of the house, or even someone who pretends COVID doesn't exist, all these people deserve to be healthy. This is their human right. This is what they're born to be able to live a good and healthy life. And so I think it's really important that as clinicians, as healthcare providers, as governments, as insurance companies and the like, and even the general public, we think, how can we get people to follow the simplest rules, easy enough to adopt, that can still keep them healthy and live good lives? Can involve lockdown, can involve masks, can involve taking vaccinations, but what's the simplest message that you can provide? And it needs to be consistent. When it's a different message for different countries, people are like, why is it one rule in this country and another rule in another country? Why is it this rule in this city and another rule in another city? And then people start thinking, and it's like, thinking is very dangerous. I don't mean like, oh, people shouldn't think because they should be controlled. I mean, if you're thinking and there was a rule that already ruled out issues that you could face and you break that rule, then suddenly you're putting yourself in the harm's way. Like, I shouldn't be thinking when there's a set way of trying to resuscitate someone if their heart stopped. There's a reason why it's called airways, breathing, circulation. You're supposed to do it in that order without fail. You shouldn't be thinking about it. You should be just doing it. And that's the dangerous part of thinking when you're having to deal with a pandemic like COVID, is that people are supposed to have free will, do what's best for them, but you don't want people, where possible, to be using their free will and it's going to be harming other people. You can't control them because they've got free will. Right. They're supposed to have choice. Right. So it's very, very, very challenging. And I think the strain that it's having on the healthcare system is really noticed by the fact that people don't always know how best to react. They're coming too late to see the doctor, so their symptoms are really severe, or they're just not seeing clinicians at all. And then the other end of the spectrum is when people are really sick and they're dying or they've died. The emotional stress that's being caused by people not being able to see their loved ones is devastating. You know, I've had a lot of either a few relatives and friends of mine who have passed away over the last year and a half now, and there was no means for me to go to a funeral. You have to see videos online. It's devastating. It's devastating for the clinicians who have to deal with that as well, not just the patients and their loved ones.
Right. I think you pointed correctly, but okay. So I'm taking few questions now. Then I think I request audience. So if you have any questions, please put those questions on the chat. So after I finish my questions, I will take those questions. Okay. So as you correctly said, things are very in some bad shape. But I have next question regards to healthcare itself. Uh,
Mhm.
so does our existing healthcare system or what we are currently following in a clinical UX, uh, so are we ready for these kind of a situations or the professionals they are in currently in practice? So maybe today we have this corona situation. Maybe in few years we can come, something other virus will pop up somewhere, and we again go in the same situation. So as a clinical UX practitioner, where we stand today and what you think, what should people should learn, and or what we can learn from current situation and how we can improve
Yeah.
through design, or you can suggest something where we can do improvement, or even the how we can study these things.
Mhm. Yeah, this is a really good question. So there's a few things that comes to mind. The first thing is that there's been a huge rise in telehealth, but that rise is not just because of um, the pandemic, to be honest. There's been a desire for people to be using more digital solutions. The pandemic's definitely been the biggest drive for it, but it's also the fact that the pandemic has proven that when you do just have consultations over the phone, it can solve most problems. Because a lot of times, right, if you've got certain symptoms, could be chest pain, headache, breathing problems, problems if you go into the toilet, any sort of issue, just speaking to the doctor just to go through a few things makes you know, is this an emergency? So you could die from this if you don't do something in the next minutes to hours. Is it urgent? So something could get worse over time and you need to do something about it over, hours to days. Or is it something where, it needs observing, but it's not an emergency or urgent, right? You need to make that clear. Or is it something that's just not an issue at all? And it's just getting that feedback from a clinician, because that's the current way of us getting good medical advice is normally you actually have to see a clinician. Even if you Google stuff, it's not personalized enough. There's still interpretation that you have to make. And if you don't know enough about disease and medicine, your interpretation could be wrong. So ultimately, people are still seeing clinicians. And the pandemic has proven that, even though I say we've proven before the pandemic that a lot of diagnoses can be made just through speaking to somebody. Don't even have to see them, right? We get more information when we see a patient, when we can shake their hand, let alone do an examination, tells you about their strength and their energy levels and things like that. But you can still figure out what's going on with someone, at least triage and determine how serious is this problem over a phone call. And so, because the general public are noticing that that actually kind of is true as well, they're willing to still have more consultations, but it's not enough. If you need to have a diagnosis of something completely unrelated to COVID, so diabetes, or you've broken your hip, like you've clearly fallen, you've broken your hip, like because there's even blood, you see the bone protruding. You don't need to speak to someone on the phone to know this is an emergency. But in those sort of situations, telehealth is not going to be good enough. So you still have to have physical examination, physical intervention, some sort of treatment, surgery, stuff like this. You have to physically be with the patient somehow. And so we at the moment have not set up a healthcare system globally. There's no country that's expert at this at all. No country has been able to nail it where people, when they have general problems that are either urgent or just otherwise not an emergency, that they can manage that themselves or manage it outside of a hospital most of the time. We have not been able to, like so many people go to A&E because they have a bit of a deep cut. They have, or they go to A&E even because they have toothache. You're supposed to see a dentist, right? All this sort of stuff. People going to A&E even with a cold. Before the pandemic, people have a runny nose. They're going to see an A&E doctor sometimes. This is not appropriate. So when there's loads of people having to go to A&E or go and see a GP, family doctor because of COVID, there's too many people already using the services already for reasons nothing to do with COVID. So that is the problem. We don't do enough about preventative medicine in the world. And this is where digital therapeutics come in. A digital, evidence-based, product, tool that can prevent, manage, or treat disease. So someone can go to their phone and actually put in their signs and symptoms. You know, the system detects stuff like blood pressure, heart rate, you know, could even do blood tests. You can do blood tests at the bedside, blood tests in someone's home, you know, sophisticated blood tests, not just glucose readings. We've got the technology to do this for many years. All of this together can tell people, well, this is a likely diagnosis, or this is how your known diagnosis has changed. This is the change to your treatment. These are the sort of medical devices, medical technologies that we need to have as mainstream technologies. It's a lot of effort though, because it's not just making sure that it's accurate and reliable, it's also ensuring that people can trust it, because people don't really trust chatbots. They don't really trust AI the way that they need to, you know, but that's what we need to be working towards. I think that's what's going to relieve the strain, is where people can trust managing their health on their own, and they do so with tools that are reliable and trustworthy, right? That's what we need, but we need a lot of investment in this. And as I would say that that investment is now starting to happen as of last year in particular. There's a lot of investment in digital therapeutics now.
Yeah, I think that will be a maybe I understand the pandemic is not the only reason for people are following this, but definitely in futuristic, if you think, then definitely the what you are saying is very, and I think this is a I think opportunity also for the UX practitioners should take this clinical UX as a serious domain, and they should start uh, at least convert their mindset from typical design development to this thing. Okay, now I'm coming
Mhm.
to a few last questions, and I request participants, if you have question, please start putting on Zoom chat box so you can take those questions. Okay, now couple of last questions. So what you think, the future, I think few points already we have discussed in earlier answer, but uh, as a technology, because there are a lot of breakthroughs we are making in machine learning, artificial intelligence, or maybe AR, or a lot of wearable gadgets now we are there. So where is you see the clinical UX or health sector, and how the people who already the current UX, the typical UX system we follow in a typical projects. So where do you see this sync up, and how the practitioner who's currently can prepare themselves for these futuristic healthcare scenarios?
Yeah. So as mentioned before, digital therapeutics is definitely part of what we need to make healthcare better, so that patients, the general public, can manage their health without having to see a clinician all the time. They can do assessments and get appropriate treatment or changes to their treatment using algorithms. And when it's more complicated, where there's loads more data that needs to be processed, and you need to apply weighting, you need to have an intellectual sort of processing of that data. This is where the AI comes in. That's where we need to be focusing. So we need UX professionals who understand about different diseases, especially the disease of the digital therapeutics trying to treat. So diabetes, cardiovascular disease, I would say things like just diet and nutrition as well. These are the big things that are having a huge impact on people's lives. The so-called non-communicable diseases. So communicable diseases, we're talking about infections. Digital therapeutics aren't really going to do a lot for communicable disease. If someone is going to have malaria, you need actually medication for that. It's not a digital tool to solve that. If it's a disease that is a chronic illness, this is where you need to be changing the treatment sometimes, changing behaviors. And this is where the digital therapeutics come into play. And I think we need to start thinking about, well, augmented reality, virtual reality, these can help in certain situations. They're very good for rehabilitation, whether it's because of psychological trauma of some kind, or it's physical rehabilitation, physiotherapy. This is where augmented virtual reality is very, very powerful. But if you're wanting to do more assessments, to do what we call, for example, caring at home, or aging in place is another term for it. So caring in place, this is someone who is sick, but their complex health needs are being managed and dealt with at home. So it's a bit like you have a nurse living in the house, and they're always looking after you. This is caring in place. And aging in place is very similar, whereas like you have residential care home or nursing home, but that's whole sort of functionality and ability to look after someone who's very elderly, but them doing so in their own home. We don't have to have humans checking in on the patients all the time, checking in on these people. You can have computers doing this, computer vision, reading what's going on in the room, assessing what is their behaviors and seeing, have they deviated from what they normally do? I've noticed that this elderly patient, they've not gone to the toilet for 12 hours throughout the day. So not just overnight, but throughout the day. What's gone wrong? Have they become constipated? Is this something where they're going to escalate? They haven't eaten anything. They haven't turned on the TV. They've just been in bed the whole time. Is there something wrong? These are just triggers to be like, well, what should we do next? So computer vision, natural language processing. So just taking in whatever someone says and being able to process that information can reduce the need of having to have clinicians to see patients, because the most important thing that clinicians do, other than making prescriptions, putting their signature to things, is actually interacting with the patient to answer their questions. That human element of knowing that things are going to get better, or if things are bad, like it's a terminal illness, that we've got options to look after you. So we don't want to remove that human element. We can't replace that with AI. But there's a lot of stuff that doctors are doing that is algorithms. It's simple flows of, well, if this is what you see, then do that type situation. And, and there's so many of them that one person can't memorize them all. So we'll then go and read guidelines. So you can get computers to do a lot of this stuff.
Right.
But you can't completely remove the human element, because I don't think humans are designed to be isolated from other humans. It can actually cause us to suffer a lot of psychological damage. But that's something we need to think about, is how can we get the technology to do more of the task for us, to make it more efficient and lower the burden and the need of clinicians, and so that people can actually manage their health at home. Because we've got to be honest, hospitals are for sick and dying people. We don't want to keep sending people to hospital. You want to try and reduce that. Right. So you want to see how can you get someone to keep themselves healthy at home. So we need to understand about healthcare, understand about disease, understand about technology, and understand when we make a change in how someone engages with healthcare, what are the pros and the cons of that? There's going to be consequences for any of these changes. And we've got to try and assess that as much as possible. We can't completely predict the future, but we've got to start thinking, if we start making changes like this, introducing digital products, getting the general public to manage their health more on their own, could that have any negative consequences, and start designing for that as well. So this is where systems thinking and social technical systems also comes into play. So learn about digital therapeutics, learn about artificial intelligence and machine learning, computer vision as well. I think is quite powerful in natural language processing. But not that to make these technologies, but understand what's their functionality and limitations. And then also start understanding more about different diseases, and then learn also, make sure you got skills and knowledge of socio-technical systems and the complexities of, if you make a change in one area of a system, will there be consequences that are both positive and negative, and how can you make sure that the system is as optimized as possible?
I think there is a lot of things now for the people who want to learn UX. Okay, now I just take a few questions. I think so we need a question. So he's asking, how can UX ensure every type of people participate in a clinical trial? Because people from remote location of each country do not come forward in participating.
Yeah, this is a really, really good question. And ultimately, it's kind of what do you do on a case-by-case basis. But in principle, I find that a lot of times, like you've alluded to in your question, a lot of times when we are doing clinical trials, we'll ask the doctors to help out with recruiting the patients. So that the doctors, you're seeing patients, subsection of those number of patients you already see. And a lot of people who are in remote parts of the world, they may not even be seeing healthcare professionals enough. So there's two things to consider with the clinical trial. if they're not normally seeing the healthcare professionals, the outcome of the clinical trial may never actually be of benefit to them anyway, because they're not going to see it. So I'm not saying don't try and get remote people, but the fact that they are not normally seeing the services means that whether they're in a clinical trial or not, they're not going to make any difference to their likelihood of the output of that clinical trial helping them. So we need, as healthcare professionals, before even clinical trials, to do more for people living in remote parts of the world. And again, this is where the whole topic of digital therapeutics comes into the play. Because it's not like people living in remote parts of the world don't have mobile phones. They might not have the most latest Apple iPhone, but a lot of people, people are more likely to have access to a mobile phone than to essential healthcare services. We've got people
Right.
who are able to do SMS. They might have a phone that allows them to do Facebook and WhatsApp, but even just SMS can still have communication with clinicians via SMS. You can actually access a medical record with SMS if you have the right codes, the right system set up. So I think we need to think, how are we able to provide healthcare services and the richness of the experience, such as someone has a prescription and someone can pay for it digitally, through insurance. But they don't have to have the latest phone. They don't have to travel hundreds of miles all the time, especially if they've already got a diagnosis. So I think we need to think, how are we actually able to reach out to the remote parts of the world in the first place, and not just rely on the clinicians, because the clinicians are not reaching them already.
Right. I hope Vinit, you got your answer. So anyone else have a question? Please can ask questions. Okay. So meanwhile, Doctor, I have one question for you. Okay. So I know you are doing a lot of activities as a UX community, and you know, so as a personal level, what is your future plan? And how, because the clinical UX, I know you do sort of activities, so you can just put some, you can give audience about your own activities regards to how you can spread this clinical UX, and specifically how people are there to want to do or enter in this particular domain. So just can explain us, how, what is your future plan, what you are doing in for this regard.
Yeah. So at the moment, I actually teach my own clinical UX course. It's a 12-month part-time course students learn on the weekends. And I'm looking to repeat that later on in the year and break up the course into smaller components so that more students will be able to take it. I'm also exploring how I can allow students to be able to do these lessons just online. And not all of it online. There still has to be a component where they can interact with other students and interact with me, because I think it's almost impossible to learn the skill of a UX professional just through self-directed learning. I think you need to have some mentorship. You need to have peers who are doing the work as well to get feedback. And that's how we learn and grow as practitioners. It's lifelong learning. That's why, as much as you can have expertise, I don't really think you can be an expert in UX. There's always something to learn and growing. So teaching clinical UX is part of it. I'm also writing a book at the moment, the Clinical UX Career Guide. Depending on when you're listening to this, it's either that I'm still writing it or it's available. But that book, the whole point of it really is to help someone answer those most common, basic, fundamental questions of clinical UX. So what is clinical UX? Why is it important? What are the skills of a clinical UX professional? How to acquire those skills? How to get a job in clinical UX? And then some interviews with a few people who have made that transition, taken that leap into clinical UX. So I think it's important to share what I've learned with as many people as possible, and I try to do that through talk shows like this,
Yes,
conferences,
yes.
teaching
I
in my
think
course.
very unique. Your background is you already have I think MBBS doctor, and now I think this is very unique combination. After a very long time, I also had to, so, and it is great to, I know personally, and we are interacting this way. So when you say you do interact with for this, so how is response? How you, what kind of a people approach with you? They are either from a digital or UX professional, or some other discipline also they want to learn this subject.
Yeah, so there's a growing hunger for clinical UX, not just healthcare UX. Part of it is the fact that the global digital health market is worth, what, maybe like $250 billion or so. So it's a very, very lucrative industry, US dollars that is. Very, very lucrative industry to work in. And so a lot of investors are like, let's put some more money into this. And they know though that products that are not easy to use, are not attractive, these products don't really sell. So there's been a rise in the demand for UX professionals for that reason, but oftentimes it's still around that field of UI design, which is only just if people are only from a graphic design background and they don't really do any research methods and stuff. It's only really just how does it look so it looks nice. But as we know as UX professionals, it's about the usability of the solution as well, whether actually people can perform a task with it easily and efficiently, and they would want to repeat the task if necessary or encourage others. These are markers of good UX in a product or service. And so there is a growing demand for it. And so that demand can oftentimes come from startups. It's definitely coming from the pharmaceutical industry, because big pharma, they can only make so much money from drugs, be it because the licensing agreements that they have, where the patent was only for them to make the drug, they become generic versions of the drug so other people can make it, so they can't make as much money from that drug anymore. But also, there's only so many drugs on the market, and it takes many years to develop a drug and put it to market. So in digital health, you can make a return on investment much quicker. So the pharmaceutical industries, in order to make much more profit now, they are going into digital health. And then there's also other healthcare companies, could be hospitals, or specialist services that support hospitals. They themselves need better products, better ways of working. And so they're a source now of demanding for UX professionals. You don't have to come from a clinical background. It's only an advantage in decide that the healthcare aspects of the competencies you need to learn comes already from working as a healthcare professional, but you need competencies in psychology. You need competencies in design. I don't just mean visual design, I mean problem solving. Design is a problem solving discipline.
Right.
So you need skills in that. You need skills and knowledge of technology. You know, even if you're not a developer, there's still an understanding of, well, what's HTML5, CSS, what's this web app or native. You need to know what these things mean if you're going to be working in this field. And then there's the professionalism side. You know, how do you work as an individual or in a team? How do you work in a company that's got low UX maturity or high UX maturity? You know, how do you deal with conflict in the workplace? How do you work and try and make a product that's actually going to be commercially viable? You know, these are all skills where, depending on your training or previous career, they can help prepare you. But it's not going to stop or remove the need to continue learning in the other areas of these competencies. So psychology, design, healthcare, technology, and professionalism is how I categorize it.
Right. And I was just also surprised when when you are speaking, you are taking some technical terms, HTML, CSS. Being a doctor, uh, I can now understand how much effort and time you have put going through these things and everything. I think, okay. So let's take last question. I think we have Abhijit, he has asked, I think you already answered this, but let's see. So how augmented reality and virtual reality applications are impacting the healthcare industry with a wide variety of possibilities. So
Yeah.
in the future,
So I see augmented and virtual reality more so in the medical education space. So we use it as a much safer space in order to teach a lot of practical skills and role play. So for example, there's a lot of times when you can be using both augmented or virtual reality in learning surgical skills, but it can never fully replace dealing with a human body. So it doesn't remove the need to perhaps learn through a dissection of a cadaver or actually operating on a real patient. But the initial parts of us understanding anatomy and physiology, seeing how things operate in an operating room or in a clinic, just seeing what it looks like with the virtual reality headset. It's very, very powerful, especially when someone isn't ready to be in that environment just yet. But then you can see this same sort of thing happening in the clinical side of things where it's being used as treatment. So for example, there can be people that have various forms of addictions or phobias, which can be using in particular virtual reality, again, where it's fully immersive. If you've really nailed down how to provide sound and visuals in such a way that people aren't getting sick, because there's a lot of, sort of sickness people can get, vomiting, nausea they get from using VR. But if you can have technology that can remove those symptoms of nausea and you have a full immersive experience, people can forget that they're wearing the headset. They're in that state of flow, is the technical term. And in that state of flow, they're experiencing something new. It can be very therapeutic. If someone's like, I don't like being out in open spaces, they're in a virtual reality and then the space gets bigger, There's someone who's having to get familiar with shopping. They've had, some sort of cognitive impairment, could have been a stroke, could have been brain damage. They're not used to doing shopping. They go for a virtual shopping ride, they go through a supermarket virtually with the headset on. So there's times when it really is taking medicine into new ways, because a lot of times we think, well, medicine's about if someone's got a problem, give them a tablet or they have an operation. But actually, medicine's supposed to be keeping you healthy. Good health is the absence of any form of physical, mental, or social ill health or any issues, really. So even socially, just being able to interact with other people is a sign of good health. You're not got any anxiety, any stress. This is a sign of good health. The fact that you don't have a cough or a cold or any physical symptoms, this is all good health. And so modern medicine is supposed to be keeping you healthy. And it's things like rehabilitation, being able to be comfortable in your space, being able to be happy in yourself. That's what good health is about. And it actually goes beyond what a lot of us can consider modern medicine is supposed to do. But that's where I see augmented reality, virtual reality being able to help. And for sure, where I see us as UX professionals being able to help as well when we start designing better healthcare products and services.
I hope Abhijit, you have answer for. I think once again, I will just thanks everybody and thanks Doctor for joining today's session. And I hope in future we will have more interactions and we can some way we contribute to the design community. So I will look forward for those more activities. So thanks everybody for taking your time and attending this session. So we have next UX talk tomorrow also. The internal Paul, he is talking on customer journey maps. So this is also very UX process. We do journey maps. So hopefully that will be also very interesting thing. Once again, thanks, Doctor, and hope lot of things we'll do together, and hopefully we can bring some good solution to the community so that uh, we can, I think we can use two-way the UX as has to be used. Thanks. Thanks for participating. Yeah.
I'm really looking forward to see how what things are going to be evolved when and there will be a good contribution from Dr. Gyles on clinical UX. So yeah.
Yes.
Thank you. It's been a pleasure. Thank you for having me.
Yeah. Thank you. Thank you very much.
Thanks. Thanks. Bye, everyone. Take care and stay safe.
Bye-bye.
Bye.